Well, the chairperson of the Portfolio Committee on Health, Dr. Kenneth Jacobs, has welcomed the release of this SIU report on digital vibes, and he joins us now from Cape Town. Mr. Jacobs, thanks for making time. So this report is finally out. There are a number of officials from the health department that have been implicated. What steps will you be taking as the oversight structure to ensure there's accountability?
Good afternoon, Clement, and thank you very much for the opportunity, and also good afternoon to the viewers. We have a very simple mandate, and our mandate is accountability, and also to make certain that there is good governance within our departments. And so we have decided that on receiving the report that we will have a portfolio committee meeting where we will ask the Minister and the acting DG of the National Department of Health to come and do a presentation. And we are actually hoping to have that meeting within the next 2 days.
Do you know how many people are facing disciplinary action now in the health department? We know about Dr. Sandile Buthelezi, that he's on precautionary suspension, if I'm not mistaken. But there are other people like Dr. Anben Pillay, Popo Maja, and others who were informed of the findings even before this report was made public. Are they being disciplined?
That is not something that we are aware of at this point in time. We are only aware of the DG actually is on suspension. We admit that we've been waiting for the report, and the report was for the presidency, so that we haven't had any insight until today. We also accept that there are administrative manners in which things are done with, and we are hoping that the department will be able to do what it is supposed to in terms of the administration and the actions they need to take.
Yeah. The former health minister is found to have lied when he said he and his family didn't benefit from digital vibes. The SIU found that he failed in his oversight responsibility, that he shouldn't have signed off on budgets that were already approved. And these are serious indictments on the former minister. But he never got to take responsibility and be called out by his boss, the president, even though the SIU recommended that action be taken against him. In fact, he was praised when the president reshuffled his cabinet for a job well done. That's not accountability, is it?
Well, we have only really seen the report today. We accept that the president has to deal with this in the manner that he is supposed to, because he appoints executive members. And in the same manner as we think that the National Department of Health must deal with the administrative manners, and we will certainly be asking the relevant questions.
Does he escape scot-free though? If as Parliament you also look into this matter, can you even still call on him to account?
Well, at this time the minister has resigned, but we are also noting that any person can be called to either Parliament or to a committee of Parliament. And we will have to see what the Portfolio Committee does with regards to that. But certainly it is an option, and we will have to see how this unfolds in our committee.
Yeah. What do you think the health department needs to do going forward to avoid a similar thing happening again?
There are numbers of things which the health department could do. I think they're basically based on three premises. One is to rectify, to improve, and to implement best practices within the department. Now, we do understand that it could be easier said than done, but we would expect the department to be able to do this considering how well it's done with the COVID pandemic. And so we are actually hoping to ask the department what those plans are with regards to improving in terms of the PFMA, the supply chain management, the national treasury regulations, etc.
All right, Dr. Kenneth Jacobs, I really appreciate your time on the lead this afternoon.